Hello and welcome to Women in Retail Talks, the podcast where C-suite executive women in the retail space share their stories of professional growth, leadership development, personal journeys, and more. I'm Marie Alvarez at Women in Retail Leadership Circle, a membership-based community of executive women at leading retailers and brands. Today I'm joined by Colleen Lindholz, the president of Kroger Health, the healthcare arm of the Kroger Company. She's also the chairperson of the National Association of Chain Drugstores. In this episode, we're discussing Colleen's long career at Kroger, how she became the first ever president of the Kroger Health organization, how she came up with Kroger's food as medicine strategy, and the impact COVID-19 has had on her team and the organization. So Colleen, hi, thanks for joining me today.
Hi, Marie. Thank you so much. I'm thrilled to be here.
Yes, I'm excited to have this conversation. So before we kind of get too deep into things, I'd love if you could just kind of start out by telling me what your responsibilities are as the president of Kroger Health.
So I've been with the Kroger Company since 1995, pharmacist by trade. It's an honor to lead the Kroger Health team, which is a group of 23,000 healthcare associates from our pharmacists, nurse practitioners, physician's assistants, dietitians, technicians. I lead a group of those folks across 2,200 pharmacies and 224 convenient care clinics. Our vision, Marie, at Kroger Health is to help people live healthier lives. And as the fourth largest retail healthcare organization in America, sitting inside America's largest grocery retailer, we really believe that we have a responsibility not only to deliver better health outcomes to the communities that we serve, but we've got this responsibility around focusing on preventing disease before it starts, which is where our food as medicine strategy comes into play. So I lead the healthcare arm and the overall health and wellness strategy for Kroger.
Yeah, and I definitely want to ask you about that a little bit later on. But first, I think addressing the elephant in the room, I think everyone is a little bit interested to know what your day-to-day looked like when COVID-19 became prevalent and how you managed and prioritized your day.
Yeah, man, it's been crazy the past couple of years, but I'll tell you that throughout the pandemic, the number one priority for the Kroger Company has always been the safety of our associates and our customers. So we've always kept that at the forefront. And from a managing, day-to-day standpoint, I mean, it definitely was day-to-day. I mean, from the very beginning, our teams spent almost 1 year meeting 7 days a week on a call because we had to continue to pivot, fast, change protocols in our stores, whether that be social distancing, whether that be delivery that we were doing in pharmacy, whether that be testing that we deployed across the country. I mean, we really needed to meet on a daily basis. And I remember when Rodney McMullen, our CEO, I gave him a call on a Sunday night and asked him if I could wire $2 million. I needed $2 million to wire to our lab partner because in order for us to deploy testing, we needed obviously the supplies to do it. And that partner hadn't even been vetted or in our system. And so, I remember him, and he's a really great leader of ours. All he said to me was, he said, Colleen, he said, as long as we are not making it mandatory for our healthcare associates to go out and do this testing, and you're keeping their safety first, and I'm all for it, you can have the 2 million. And I told him, I said, Rodney, I don't think I'm going to have a problem with getting our folks to go out and do this testing. I think that, we were kind of born to do this. I mean, we went to school to do it and we're ready. So it was really exciting early on to get, obviously the support from the highest levels within the company. But we also decided early on that we were not going to settle, that we knew we were going to run into roadblocks, but we were going to have to figure it out. So it's definitely been a challenge for us, but at the same time, it's truly been an honor.
So at what point did you realize that you needed to pivot from those meetings every single day, 7 days a week, to whatever strategy you've got going on now?
So I think we broke out into groups basically within Kroger, and those teams meeting 7 days a week were everything from our corporate affairs team on how we were going to message to the public, to the HR folks, and obviously the labor that we needed inside the stores and outside of the stores in order to do things like COVID testing and vaccines. I think the groups along the way, we kind of broke into groups where the individual groups were meeting. We sort of had centers of excellence sort of within the Kroger Company that were working on making sure that we could deliver what we were telling the public that we could deliver. So we went from, 7 days a week, like everyone on a call, like a whole lot of people on a call, to really breaking up in groups and sort of having our own, like I said, centers of excellence that we could, individual teams could work on. I'll tell you one thing, the Kroger Company is a big company, But during this pandemic, we most definitely moved at a pace that mattered. I mean, we used to innovate in months and years, and we went to doing it in days, days and weeks kind of thing. So, but that was because those groups were very focused and obviously very dedicated to being able to deliver what the country needed.
Yeah, I feel like that's what we've heard for retailers all across the country, right? Is that just in the last 2 years, like their need and they were forced to innovate so quickly. Are there any specific strategies or advice you have for kind of implementing that? What are some of the big takeaways that you implemented?
Well, I think the one thing that we really relied on early on was our CPG partners and our partners to be able to get us like the masks that we needed and the supplies that we needed, to not only keep our stores open, but to keep people safe. So early on, between our CEO talking even into different countries about potentially, what they were doing and strategies that they were implementing, we brought those back within the Kroger company. And whether it be a company that would make and can some of our brand foods for us. They switched to, actually doing hand sanitizer and, and making sure that they could get us the supplies we needed. So the strategies early on were just like, we can't do this alone. We've got to have other partners, and our partners really, tell you what, answered the call. I mean, they were coming at us on a daily basis, asking what they could do to help us, all the way down to having people from our partners saying, hey, can we show up in your stores? I mean, is there anything that we can do to help put groceries on the shelves or, help people? Because our grocery stores were obviously tremendously packed during that time. People stopped going out. Obviously, restaurants closed. So we had to make sure that we had what the country needed. And our stores weren't built for that kind of volume on a daily basis, but our partners really helped us out.
Yeah, that's great. So, I mean, you're doing this leading, like you said, 23,000 professionals. How has your leadership style changed? Have you seen it evolve at all since COVID hit? Is there anything that you're doing differently than you were pre-COVID?
I'm really glad that you asked me that question, Marie, because what I'm really proud of is we put together a collective health and wellness strategy back in 2017, where we literally laid out our vision, our mission that was all governed by our company's purpose, which is to feed the human spirit. And because we had laid out that solid foundation of a vision and mission, and we were training our healthcare professionals to practice at the top of their licenses. So we were going out and like doing things by state, immunizations, different things that nurse practitioners were doing to practice at their top of their license. So when it came down to this, it was all about reminding people of why we're doing what we're doing. And another thing that I did early on was reminded our pharmacist, because I'm a pharmacist by trade, of the oath that we took. And so do the nurse practitioners take an oath. And that oath says that, we're going to dedicate our lives to the betterment of humanity. We're going to consider the suffering of humanity our number one concern. So it was about going back to our roots. It was about saying, hey, we laid our strategy and our vision, our mission out a while back, and now we're executing against it big time. Like we are living it. We are a part of something bigger than ourselves. And I think that was what was really inspiring for me with all of our healthcare professionals on how many people that it took to, do the big mass clinic events that we did. And people were volunteering on their day off. I mean, I wasn't getting any like pushback from our healthcare professionals on, oh no, we can't do this and do our job inside the stores. I had an overwhelming number of people that were volunteering. So it was inspirational. But like I said, I think I had a little bit of an advantage because we had already laid out that vision and mission early on.
Yeah. So speaking of motivation, have you found it more challenging to motivate your staff now, kind of 2 years later? I know our members talk a lot about, we're 2 years into these like virtual meetings and this work from home, and like they're trying to find creative ways to motivate their team to bring that team culture back. Have you had difficulties with that as well?
Yeah, I wouldn't say that we haven't. We've most definitely had difficulties with that, especially like the corporate team. You realize that obviously our store teams, we've never closed, and our people have been on the front lines of the front lines the entire time. Making sure we're still out there in the stores with our people have been one of our number one concerns. But at the corporate level, it has been hard to stay motivated and to keep people engaged. We've done all we can, one-on-ones with associates. We've had different types of huddles. We've had different types of celebrations, at the end of the day, to pull people away from like their computer, 12 hours a day and try to do fun stuff. I think during the pandemic, We learned a lot about families, and I think we got a lot closer on just like who's who, and who has cats and dogs, and what's the name of your kids type of thing, which I think for me as the leader, developing those like personal relationships with people like reaps rewards for like years to come. Because the more personal relationships that you can have, the more you understand who people are, what they like and what they do, I think the better off the overall working relationship is. So I'm starting to bring people back right now. I have 50 people that are in town from across the enterprise this week to do some training from across our, pharmacies and our clinics across the nation. So we're trying to get back to somewhat normal, but I would say it's most definitely been a challenge to keep people motivated.
Yeah. And it's almost like try anything, right? Like see what sticks to the wall when it comes to like building team culture and that sort of thing.
But I think being honest too, Marie, just like being honest with each other that like, yeah, like we're tired,
Yeah.
I mean, we're tired, like, we need a break, and encouraging people to take their vacation days and to make sure that they, cut it off at the right time at night, because when you're working from home constantly, you find you're just was working a lot more than you were when you were in the office.
Mhm.
So we've been trying really hard. I have been as a leader to try to be an example of that. Which is hard for me sometimes because of the magnitude of the business. I feel like I need to work at, other times, off times, but I try to have some disciplines on my side where I, make sure I tell the team that they need to concentrate on their own mental health and mental well-being.
Yeah. Yeah. I mean, it's so enlightening and helpful to know that like, oh, the leader is going through the same kind of things that I am, and she's not afraid to be transparent about it. I think that's super nice. So I want to go back a little bit to, I guess, 1995 and the start of your career. Let's talk about the span of your career, Colleen. How were you able to move up within the company, and how did you know when it was the right time to do so?
Yeah. So in 1995, when I joined the Kroger company, I came as a staff pharmacist, and my goal at that time was to just get in the stores and, take care of people and practice pharmacy. And, I found that like just really hard work, dedication, building relationships with my store manager and, the people within my stores is really helped me grow. And what I mean by that is I didn't understand the business side of the operation. I didn't go to school for that, but I developed really great relationships early on with one of my store managers. His name's Bob Aders, that really challenged me with like the operating statement. I'm thinking, what I sign up for? I mean, I signed up to be the pharmacy manager, not to worry about every single line on the P&L. But, early on, I really thank God that I was with people like him, because he forced me to learn the business, which then at the same time, it kind of motivated me to want to do more and want to do more. But it was all about like who I was around. And then I would say that it was about taking the road less traveled. And I know that, that's a poem that everyone knows. But I really said to myself, if I'm going to be able to lead at a higher level at Kroger, I need to understand the total store. So one of the things I did was I took a step back in my career. I actually went to HR to recruit in 2008. And once I had recruited the total number of people that Kroger had asked for that year, I asked my manager at the time, who was the HR leader for Kroger, I said, hey, I want to go back through the management training program. And he said, are you nuts? You're making, X amount, and the co-managers at the time are, a lot less than that. You sure you want to do that? And that's a big pay cut. But, I really knew at that time that if I could gain the respect of the people that worked in the rest of the store, if I could understand the meat department and, the night crew and the deli and how hard it is to actually work deli, by the way, deli is a tough department to work, that I would gain the respect of the people. And that's something I'm still working on today, on connecting the healthcare side and the food side, the food is medicine strategy. So early on, I said, hey, I'm going to take a step back in order to try to take steps forward. And so that's one of the things I did that helped me I feel like helped me get promoted, or, people said, hey, she's the real deal. Why is a pharmacist over here, like, pulling the trucks and putting stuff up on the shelves? And I didn't want them to see me as a pharmacist. I wanted them to see me as, part of the team. Yeah. So I stepped outside my comfort zone. And when did I know it was the right time? I mean, I think that you don't necessarily need to worry about like your next step in your career, that you need to grow where you're planted. That's a quote that comes from Tim Massa, who is our chief people officer in the company. Hey, grow where you're planted. And then when the next opportunity comes up, take it if that's the one for you. So that's what I did. I do want you to know I had a lot of disappointments. One of the big disappointments in my career, which I was told I was going to come here to general office and get a particular job I was getting sort of groomed for a particular job. When I didn't get it at that time, I was really disappointed. I had left the Cincinnati division, being the leader of the Cincinnati division pharmacies, which I had 103 pharmacies at the time, which I loved the job, to come down and do something that then I didn't get. But I told myself that it will be a defining moment, the way I handle this, right? The way I handled it in front of other people, which was really important. And I said, there's got to be something that's better, or something else that's coming for me in the near future. About 1 year later, I got a visit from Rodney McMullen, our CEO, and he asked me then, he said, I'd like you to go down to, go take over the little clinic as the president and CEO of the little clinic. Remember, at the time I was a director. So to take over as president and CEO of anything within the Kroger company was a really big deal. But I only tell you that because that's real examples of, sometimes you get disappointed and you don't get to move up, but it's all the way how you handle it and like what you learn from it at the time that I think others around you notice, and then you get other opportunities.
Mm-hmm. The other opportunity is right around the corner. You just might not see it yet.
Right. And heck, if I wouldn't have gotten to go run the little clinic for the 2 years I did and learn the nursing profession, the job I have today would be a lot harder. Right. I mean, I was able to concentrate on joint commission accreditation. Things in the nursing profession I had no idea about. I needed to learn. So it was a really good move for me. And I feel like it set me up to be able to run the team today.
Yeah. So let's talk about, since we only have a few minutes left, your food as medicine strategy that you've come up with. I'd love to learn more about that.
Yeah. So the food as medicine strategy kind of goes way back to when I was a pharmacist standing at the counter, when people would come up with, diagnosed with diseases like diabetes and say, but Colleen, what about out here? What about the food component? So we started working on food as medicine. I started working on it in 2008. I know that's a really long time ago, but I'd say in totality, we started working on it in 2013. And what we've done is we've built a nutrition scoring system. We needed to have like a foundation for people to be able to help make a healthier food choice for our customers. It's called Opt Up. It's a nutrition scoring system that basically scores red, yellow, green on our foods. And it's about the micronutrients, macronutrients, really everything that goes into making food nutritious. So we built the nutrition scoring system along with bringing dietitians onto our team. We did that in 2013 in order to execute against this strategy. And then we built a system that sits on top of our fulfillment system in pharmacy and our little clinics in ECW, which is our electronic medical record, that basically is able to speak back to primary care docs and to the hospital systems across the country. Because see, with the food as medicine strategy, it's not only about helping people make healthier food choices, changing behavior so that you can improve outcomes. It's about connecting back to the ecosystem so that physicians can understand from a food perspective, a nutrition perspective, like how are their patients doing? So we really believe in the preventative power of food. We believe that averting disease is just as important as treating it. So if we can actually prevent disease before it starts, like what not a better goal to have. And we've worked with our own associates inside of the Kroger company to prove some specific metrics about, can we lower blood pressure? Can we lower hemoglobin A1C with people that have diabetes? And can we really make a difference? And we were able to prove that within our own company. And now we're working with United Healthcare specifically on a pilot around proving the value of prevention and of better for you foods that keep people out of the hospital and actually help people live a healthier life. So I'm really excited about it. It spans everything from, tags in our stores and a nutrition scoring system all the way to testing, microbiome testing, DNA testing, things that we're still piloting right now for people to really understand themselves. But I think it's a huge component to our country's overall issue. And that's because we know America's sick. Chronic disease, 6 out of 10 people have chronic disease, and obesity is on the rise. Type 2 diabetes in very young people is on the rise. So we feel it's our obligation to do something about it. Mm-hmm. And that's what we're doing with our food as medicine strategy.
That's awesome.
Yeah.
So Colleen, what is next for you, professionally and personally? I'd love to hear more about kind of your vision over the next few years.
Yeah. So over the next couple of years, right now, we're working really hard on our progression towards value-based care. And I don't know, sure if you know, but by 2030, the Centers for Medicare and Medicaid have come out and said they want all of the Medicare beneficiaries to be in a value-based care model. Our country right now is basically a fee-for-service model, and we're moving to value-based care. So we're working right now on like, where's our place in that value-based care model? How can we contribute to, the primary care doctors and, basically taking care of people better than anyone else? We feel like we've got the assets to do it, specifically that food component. That will really help drive, prevention and overall better outcomes in the country. So we're working really hard on that and really hard on the interoperability. One of the deliberate decisions that we made with our strategy was that we were going to connect with the ecosystem better than anyone else ever has, putting the power of the data right in the hands of our customers and our patients so that they can basically, make better choices for themselves. So I think the country's definitely moving. The consumerism of healthcare is happening, meaning that healthcare is coming to the people versus people going to healthcare. And that fits perfectly into where Kroger is, our access points and our overall company goals.
That's awesome. So what about personally? Is there any goals for 2022?
On a personal standpoint, I mean, I've been honored to lead the NACDS, the National Association of Chain Drug Stores, being chairman there. I've learned a lot from our competitors, which really we're at the table working together, but I've learned a lot from our competitors. I really do aspire. I'm on a couple of different boards to really continue to give back. American Heart Association is one of them that I'm on. I also sit on Easter Seals Board of Directors, which is specifically helps people that are the underserved, veterans and people with disabilities. So in 2022, I'm out to make a bigger difference in the community on those boards, and then to continue to lead the healthcare strategy for the Kroger company.
That's awesome. So one last question I want to ask you. I know you mentioned that you had a mentor in the beginning of your career. What advice do you have for finding a good mentor? What is the mark of a good mentor? What should someone look for? A woman specifically, what would she look for?
Yeah, that is, that's a really great question. And when you think about mentors overall, I think number one, you need to find someone that cares about people. I know that sometimes in careers, you can get your eyes on certain leaders and say, oh, I wish I had them as a mentor. And all leaders aren't made equal. and I look for people that really care about people. And care about, really being good listeners, good coaches, and then looking at not who the person is today, but what the possibilities are of that person in the future. I'm mentoring a couple of people right now that I just see so much potential and possibility in like what they can do, that they don't believe in themselves right now, but I believe in them. So I'm trying to give them the experiences and the opportunities now that will help them make, choices on whatever they decide to do with their career next. I think looking for a good mentor, people that are, again, non-judgmental is really important, where they will share their experiences and knowledge and really help you kind of make a plan for whatever you're working on. I found early on when the HR leader I work for allowed me to go back to the stores and do that co-manager job, he helped sort of pave the way to what my next position would be, which, without his help, I'm not sure I would have had the confidence to go and do that. So I don't know. I just look for people that are authentic, live our company's values, live their values, even if it's someone outside the company, but that will really kind of see the potential and the possibility versus who the person is today.
Yeah, that's some great advice. I love it. Well, Colleen, I think we are out of time, but thank you so much. This was a really enjoyable discussion, and thanks for all of your advice and leadership tips, and I really appreciate it.
Thank you, Marie.
Thanks for listening. For more information on this podcast, please go to womeninretail.com/podcasts for show notes. Women in Retail Talks is available on Apple Podcasts, Google Podcasts, Stitcher, and Spotify. Make sure to subscribe on our podcast channel page as well. If you've enjoyed this episode, please take a few moments to rate and review our show. Lastly, if you're a female retail leader interested in joining our community at Women in Retail Leadership Circle, visit womeninretail.com/apply. Thanks, and until next time, this has been Women in Retail Talks.